There is more disease. There's just more COVID-19 in our community right now. I'm Jason Newland, pediatric infectious disease physician at Washington University and St. Louis Children's Hospital. The start of the spike was in Southwest Missouri. 90% of the cases in the Springfield area have been reported to be the Delta variant, which is the variant that emerged in India. And I would argue it's the Delta variant that we're seeing in St. Charles County, St. Louis County, St. Louis City, Jefferson County. All the numbers have increased. The Delta variant, when you look at the data, the Pfizer vaccine has been reported to be 93% effective against the Delta variant strain. What people should know is a variant is essentially a different version. And one might even say it's gotten a little smarter. It's made itself more fit, meaning it can start infecting other people better. And it kind of selects for itself. You get a random change and then look, it's actually infecting people more. And it's able maybe to infect some of the people that are vaccinated. And that's the biggest concern, is that we're going to get a variant that completely escapes, completely is able to get around those vaccinated people. All the vaccines, I should say Pfizer, Moderna, and Johnson & Johnson, almost 100% effective against severe, life-threatening COVID-19 disease. Whether it's the Delta variant, Alpha variant, or whatever new variant so far, it turns this potential fatal respiratory virus into a common cold, period. Common cold or nothing. I mean, that's why we got to be vaccinated. I can tell you, being someone that's doing a lot of testing in the community currently, we have some testing projects ongoing to provide access to testing. And over the last couple of weeks, we've had more positives. I have not had one person that's positive that's been vaccinated. They're all unvaccinated individuals, whether they're because they can't get it because they're under 12 or they just haven't gotten it yet. When I've talked to a good colleague and friend down in Springfield, and they're taking care of a lot of COVID-19 patients right now, his response to me was, you know what, back at the beginning of the pandemic, I kind of knew who was going to be the real sick ones and who was going to be, have a breathing tube, who was going to be in the intensive care unit. It was going to be the elderly. It was going to be people that, had a lot of other medical conditions. One of the big ones was those who are obese was a big one that we've seen. He says, you know what, now I can't predict it as well, except for the fact that they're unvaccinated. It's all of our unvaccinated folks out there that I'm really concerned about, because you could be one of those 30-year-old, healthy people with a couple of kids, and you could get really sick and land in the ICU. And that, especially now when we have a vaccine that works, and that's hard, right? It's preventable. We're all on a different journey when it comes to our comfort level with mask or not mask. First and foremost, we know that while the vaccines are great and they turn this really bad virus and really can make you really, really sick into not making you as sick, some people are just like, I don't want to be sick at all. And we have definitely learned masks work, right? Like, we have learned that you wear a mask, it is protecting you, and it's probably protecting us a lot better than we even realized it was. Now, if you're going into a situation where you're not sure who's vaccinated and who's not vaccinated, especially with what we're seeing in Missouri as of July, I think wearing a mask in those situations when you're vaccinated and you don't know who is unvaccinated, that it is a way to prevent getting the virus on another level, right? You might have 90% effectiveness with vaccine, but now you jumped it up to 100% with the mask. I was in a gymnasium watching basketball. My parents, who are 71 years of age, were in a gymnasium watching basketball. We are all vaccinated, not shocking, I know. We were wearing masks. Number one, I don't want a cold right now. I also know the Delta variant is kind of making its way through, and I'm in an area where I don't know who's vaccinated or not. I felt more comfortable in a mask. If I was next to you and you says, I'm not going to wear a mask, I would be fine with that. I'd actually have no problem with that. I think what we then have to get to is that understanding we're all kind of different on our journeys of where we're going to be with masks or not masks. And then let's just support people. Let's just support and use what we know is that masks work, vaccines working great. And then let's make sure we can continue to have these fun things because of doing these mitigation strategies, whether it's, vaccinating, wearing our masks, not coming out when we're sick. And that way we can continue to watch basketball games, do our indoor things that we've loved to do.